Hi, it's Dr. Sharon Allison. I need to have music. Don't I need to have music coming on? Hi. I will wait till somebody comes on. We're going to have some quick real talk. Come on. Hi. Say hey, what's up? Hi, Fran Cunningham. How are you? Oh wow, Stephanie Boyd. Hi everybody. This is gonna be quick, but I hope it's gonna be something that you all will enjoy. I usually just do it off the cuff, but today I have gotten so many questions this week, and many of you from around the country may have heard me. I did a lot of media this week, particularly around breast cancer awareness, some domestic violence, and also some general health. Hi, Fran. Talks and information. So I got so many questions in my inbox that I just wanted to make sure that I answered you, because I tried to do that. Hi, Andrea. And so one of the things that we're going to talk about quickly tonight, and I am taking your questions and your questions on live, as I look like alfalfa with this one piece sticking up, but your questions on live take precedence over what I have planned to talk about. If you know a woman, how many of you wave if you know a woman? Or know a woman? First of all, you know a woman because you had to be born of a woman. We are out on my patio. I'm going to enjoy it for the last little bit. But we're going to I got inundated, and I do mean inundated, with lots of questions on breast cancer screening, on both radio. I got some relationship questions. I did a relationship show in LA, via radio. But tonight I am going to talk primarily about getting rid of some of the myths associated with what you really 100% need to know about breast cancer screening. Again, we are on my patio. It's a beautiful afternoon. I just wanted to soak in a little bit more sun. So now let's hit it. Please tag somebody, tell somebody Dr. Sharon is on, check it out. And I will put this on my sites, as well as my YouTube channel. Y'all go ahead and subscribe to the little YouTube channel. We don't really promote that, but y'all go ahead, okay? And I will post it on Facebook. So let's get to it, because literally we got over 300 plus questions since Monday on breast cancer screening and all that. And I see men are on. If you know a woman, if you have a chest, you too need to be listening to this. But it's a little confusing. As you know, and I say this all the time, shout out to American Cancer Society. I sit on some of their advisory boards, but speak and train for them all year round and talk literally to thousands about cancer screening. My areas of focus are generally breast, colon, in general, as well as blood cancers and all of that. And more importantly, what to do and how to prevent. And if we can just say prevention is key. So let's hit it. Now, we know, particularly in everybody, the leading cause of death in everybody is worldwide is heart disease. That's number one. Number two is cancer, particularly in black women, in men. I mean, again, cancer is the big C word, and we need to get away from being afraid of saying the word cancer. We don't need cancer. We don't need the C word. We need to say cancer, because there are innovative treatments that are there, and absolutely with almost every cancer that there is. Hi, Harold Fisher. With almost every cancer that there is, early detection is key. And Harold did a talk for men, this week, about being a great father to daughters. I'm calling out fathers. You all learn about breast cancer for your significant others, for your daughters, and you tell your daughters, ask your daughters, have you gotten screened? So let's just hit it. And let me just tell you, as I say all over the country, this is what cancer is. It ain't deep, guys. It's not deep. Cancer anywhere in the body is simply this. a cell, your cell, not a fungus, not a bacteria, not something invading, not a demon, none of that. Cancer is a cell, whether it's in your breast, whether it's in your prostate, whether it's in your bone marrow, whether it's in your lungs, whether it's in your bloodstream, pancreas, wherever. It's simply one of your cells in your body going crazy. It goes crazy. And then it goes crazy and then calls. Y'all know how people are. Crazy people. Y'all know Kanye. Crazy people call people and tell them to come on. So we got some crazy family members and you get a little clique together, right? Or your friends are a little crazy and they get a little clique together and they form a tumor or a mass. That's what cancer is. It is not anything foreign. It is that some cells in your body lost their mind for a minute. That's what cancer is. Cancer treatment is targeting those cells and that tumor, because when many of those cells get together, they form a tumor. Can be pea-sized or it can be larger. They form a tumor, and that tumor and those cells are what the targets are with cancer therapy. So quickly, this month is Breast Cancer Awareness Month. Again, doing a lot of media, a lot of talks on breast cancer. And I'm looking at a talk that I did that was particularly cool because I introduced some new data that just came out. And so that's why I'm looking at my little laptop. But it is a tumor, basically, that affects the breast. That's what breast cancer is. Pancreatic cancer, hi, Sanita, is a tumor that affects the pancreas. That's it. That and where it starts, even if it goes somewhere else. So we know breast cancer likes to go to brain. It likes to travel to lymph nodes and to different places. Wherever it goes, where it started is what you call it. So breast cancer is breast cancer. So now, particularly, I want to talk about minority women, all women. Certainly, if you have breast, which I said this and got a lot of laughs, but if you have breast, that's a risk factor for breast cancer, period. All right? Also, men who typically don't have breast cancer. They don't have breast tissue. So you don't have breasts that'll feed a baby. But you have adipose tissue and you have breast tissue, and you too can get breast cancer. I like to talk about Shaft, one of the finest men ever. Richard Roundtree has been very open about his diagnosis and effective treatment with breast cancer, okay? So now, but breast cancer in African American women, of all the breast cancers, of 100% of all of the breast cancers, we are, 13% of the population African Americans, but we're 32% of all the new breast cancer cases in women are in African American women. So a lot of what I do, and hey Clarina, a lot of what I do and a lot of what I'm asked to talk about is, and I'm on, again, boards with Minority Health, but I talk to women of all races, creeds, and colors, men, women, boys, and girls. I'll talk. Give me a microphone, I will talk. But I do focus a lot on African Americans and health disparities, and particularly breast care disparities. Now, according to now, and if you heard me 2 years ago, I wasn't saying this, but I'm saying this now. Yes, Anita, men can get it. Hi, Mark Jones. Check it out. We need to talk some business about what we're going to do with this information. But particularly, I want you to know that I wasn't saying this 2 years ago, but as of this year and the data that's just released, I used to say all the time, raise your hand, who do you think gets breast cancer more? Black women, white women, Asian women, Latino women, what women? And then people raise their hand and say, oh, I think so-and-so, I think the so-and-so. And I used to say, no, white women get breast cancer more and black women die from it more. As of the latest data from the CDC, now breast cancer in black and white women, the incidence, a big medical school word for how often it occurs. The incidence is now basically the same with black and white women, okay? But it used to be white women got it more, but black women died earlier. So now we're about getting it about the same. The problem is this. Number one, with anybody with breast cancer or any cancer, that's a major diagnosis that affects absolutely every part of your life. Every part. But compared now, let me change my little slide. Y'all getting a slideshow y'all ain't paying for. Ain't that good? Ain't that God? Ain't that wonderful? But quickly, I want to talk about this new data because, again, it has changed. The incident is the same. Hi, Cousin Candace, is the same. Deaths for breast cancer are going down in both Black, white, and Latino women, and especially among younger Black women, which is a big plus because Black women younger have a more aggressive form of disease. Why? Why do Black women have a more aggressive form of the disease? They do because it is more aggressive if you get breast cancer at 30. It is more aggressive than if you get it at 70. Think about it. That means that the cells in your body, which I talked about earlier, went a little crazy. Hi, Sora Deidre. They went crazy earlier. That means they're aggressive, okay? And so you want to jump on that cancer that you get at 35. You want to jump on the cancer anyway, but you want to jump on it at 35 because it has proven to you that it will come after you, okay? Now, deaths are going down, but rates are still 40%. Somebody type 40% for me. Breast cancer deaths in Black women are 40% higher than white women. 40%. Go ahead, Renee, 2-year survivor. So it's 40% more. So if a Black one, if you have 100 women, 40% more. If it's 100 white women, 100 Black women, 40% more Black women will die from breast cancer than our white sisters. Not that to negate breast cancer in anyone, but just think about it. And guess what? If you're the one, or your loved one is the one that dies, you don't really care what race they are, they died. So this information is very important. Now, compared to white women, when I talk about incidents, hi, Victoria, the great writer, Victoria Christopher Murray, if you're younger than 60, okay, Black women are still getting breast cancer more. If you're older than 60, we are lower, we're getting it less. So it's really important, those nuances. Now, why do we die more? Breast cancer is more likely to be found at an earlier stage in white women than Black women. And that's the key. Latino women, the same. This is key, people, for real. We wear the pink, and I'm writing another book. I'm writing 3 books right now. But The Soul of a Woman, the first story is a short story where the woman looks in the mirror in all of her pink. She's a breast cancer survivor, and she has a reality talk with herself. We pump it up. The advocacy is great. Again, this is a large part of what I do, but cancer still sucks, right? And if you find cancer late, it really sucks. Right? Okay. So now, and the other question that I got a ton of this week is something that you hear on the radio, you hear on TV, you see. It's called triple negative breast cancer. Somebody type that for me. Triple negative breast cancer. This is the easy way to think about it. And I was doing a talk yesterday to health professionals, and we just don't get it. This is simple. If you're not an oncologist, and I'm not an oncologist, but this is the key. Triple negative breast cancer is a cancer that one of the tools that we have, and maybe 2 of the tools that we have to treat cancer, is taken away. So people have worse outcomes because you don't have all the tools. So think about cancer as a house, okay? And cancer cells as a house, and the front door has 3 locks, right? You have 3 locks on the front door, right? Great, Debbie. Truly sucks. You are a survivor of triple negative for 5 years, which is wonderful. Triple negative, you have 3 locks on the door. You want to get into the cancer and kill the cancer cells, right? Those locks are the way you do it. 1 lock is for estrogen, which is a female hormone. The other lock is for progesterone, which is a female hormone. And the other lock is called human epidermal growth factor. You got it? Okay. So and that's a protein. So 2 hormones and 1 protein. If you can go through the door hitting all 3 of those, bingo, right? That all of those, so we can give you hormone therapy for estrogen and progesterone. We can give you protein therapy for human epidermal growth factor, HERF, okay? Those are the keys. But if you are triple negative, that means that some of those locks don't work. And so now you have to take hormone therapy off the table, because that's not going to help you. That's all triple negative is. And so if you cannot use hormone therapy or other drugs, then you only have a couple of other tools to use, like chemo and like radiation or surgery. That's what triple negative is. And this is key because, again, I was doing a talk for persons that work in the field. And it's like, y'all, this is not hard. You got to break it down to a point that anybody can understand. Cancer cells are the house. There are three locks on that door. If you take away the keys, right, to therapy that get you through the door, you're locked out. That's what triple negative does. It takes away some of your treatment options, and therefore you have worse outcomes traditionally. And chemo, fortunately, still works in triple negative. So, hey, Debbie, one of my girls who is a survivor and has triple negative. Now, and guys, I want you to stay on, because if you know a woman or you love a woman, you need to know about breast cancer. This is not just for women. This is for anybody that knows and loves women, and men can get breast cancer too. Okay, so what are the risk factors? Number one, for breast cancer, guess what? The first word is breast. If you got breasts where itty bitty titties or big boobs, right? I keep it real. So if you're a AAA versus a double G, you still have the same risk factors. Hear that. Larger breasts don't mean that you theoretically get breast cancer more. Hear that. So just because you may be a double A cup, that doesn't mean I don't have to worry about it. I don't have a lot of breast. I don't care about that. If you have breast, you are at risk for breast cancer. Number one, so being a woman. Your age, okay, as we get older, we get breast cancer more. Family history, but notice I did not put that first. We have focused so hard and so long on family history as being a reason why, you get breast. No, actually, most women with breast cancer have no family history. It is important because it does tick up. If your mother is called a first degree relative, I'm going to keep it real and basic. If your mother or sister or had breast cancer, you are at increased risk. Okay? Grandmother, sister, aunt, all of those, you're at increased risk. So know your family history. Thanksgiving is coming up. I tell people all the time, when you're sitting around talking about who Nene's real daddy is, you need to stop that conversation and actually have a conversation about what runs in our family. Number one, as it relates to cancer, you want to know, number one, colon cancer. Colon cancer has the biggest tie to family history versus any cancer. But you want to know, is colon cancer in our family? Is breast cancer in our family? Now, the other thing is, and thank you, Renee. Renee, who is a breast cancer survivor, says, that's why I missed my exams, because no one in my family had it. Again, if you don't type anything else, say that most women that get breast cancer have no family history. Family history is a risk factor, but it's a secondary or a tertiary risk factor, okay? Number one is have breast. Be a woman, have breast, you're at risk. Okay, so then we talk about breast density. If you have dense breast, you are at higher risk. Now, most time when I talk about this with audience, people glaze over because I'm like, what is density? I'm a major in biology, chemistry, and physics. I forgot what density is. Density just means that it's a closely compacted in substance. Whatever the tissue is closely compacted. Y'all got that? So, dense breast means that the appearance of breast tissue on a mammogram, it looks tighter. So because it looks tighter, it's harder for the radiologist to see. Is that a shadow? Is that calcium? What is that? For myself, I do happen to be a doctor, so I'm a little crazy. I get the mammogram and be like, come on, let's go look at this right now. I don't really know a lot when I'm looking at it, but all of us had to take radiology. And so I'm usually asking the radiologist, wait a minute, what's that right there? And she's like, that's a piece of fat on the breast, because breast is fat. Or what? And, I have been very public with, I've had a biopsy and had abnormal mammograms, and word be to death, I'm all this big, talk about cancer all the time, wonderful, blah. I was like, let's get in here and do it. Let's do it. Let me find out. Biopsy this today. Let's go. Question, is fibrocystic breast a factor? Great question. Fibrocystic breasts are lumpy, right? But they are. If you have them or you felt them, they're not, they're a little lumpy. So fibrocystic breast means that you have more fibrous tissue, and when you have your period or had your period or have more caffeine or chocolate as well as caffeine, because we think about caffeine only as in coffee, but chocolate, those things, your breasts get a little tighter. They're hurt maybe when you have your period or had your period or have hormonal surges. That's fibrocystic breast disease. No, you are not at increased risk of cancer, breast cancer, because you have fibrocystic breasts. Two different diseases. However, somebody say however, because the breasts are dense with fibrocystic breasts, okay? And when you're doing your breast exam, they're lumpier, so you can't feel them as well. Thank you, Shirley. Hi, Elaine. You can't feel them as well. You're like, well, everything's lumpy. How do I know what's real? This is key, and why we still talk about, and I still talk about doing a self-breast exam. If you go to the doctor and get your breast exam once a year, okay, great. If you examine your own breast once a month, you know how your breasts feel better than anybody else. I said this on radio the other day. So the doctor may examine 500 breasts a year. That's 1,000 breasts. Okay? But you ain't got but 2. And you should know how your breasts feel. And your partner will know if you are. Thank you. If your partner, thank you, Episcopal Supervisor Marla Michon Hall Reed. You should know how your breasts feel. So you need to examine your breasts still. I don't care what the new recommendations are, and I'm getting ready to hit the new recommendations. I can tell you the health professionals are actually against many of the recommendations. Not against, but we say no, we want to keep it real, right? Do your breast exam every single month. Still. Now, one of the worst days in the month is first of the month. Why? Because you got to pay your mortgage, pay your bill, right? And you see all this money in on the 30th, and then you see all this money go out on the 1st through the 5th. And let's get my talking right, because all these bills come out. You think you're rich on the 30th, but on about the 6th or 7th, you like, dang, all this money went. Well, it would be a good time for you to do your breast exam. I'm just saying. I'm just saying. To do all, just lay in bed, pray to Jesus for some more money. And while you're praying there, put your arm up and start examining. Examine your breast. I'm serious about that. I don't know what this is. I'm serious about this. Lip gloss is cold out here on my patio. Okay, so just lay in bed. Say, Jesus, I need some more money. Hey, things are a little tight. And just put your hand behind your head. Take 2 fingers. Start at the nipple. Pinch the nipple. See if any fluid come out. Push it in. Pull it out. And see if it comes back out. And then go through 2 or more fingers and press hard. What you're looking for is a hard, non-moving piece or mass, right? Hard, not moving, like a little pea that won't move, like a frozen pea that won't move, versus one that you can squish down. Renee says, I was doing the exam wrong. I missed it because I didn't go underneath this large breast. It is better laying down. I know that we say you can do it in the shower, but think about it. If you're in the shower, everything is wet. And men online, talk to your daughters, your wives, and all of that about how to do a breast exam. Yes, you can stand in the shower with your hand up and then examine your breast. If that works for you, fine. But think about it, it's water. And water is slippery. I prefer to lay on the bed, put my hand behind your head. And I do get this question all the time for real. Can men do your breast exam? Men can examine your breast. Your husband, your boy, whoever can examine your breast. But that officially is not a breast exam. That typically is foreplay. But having said that, men have found breast cancer in women. I'm just saying. So yes, there are cases where men have been with their significant other, their sexual partner, and found a lump. Same thing with women. You can be with your man and say, oh, booby, your man boob is a little bigger. a little swelling. I'm just saying, I like to keep it real. Well, honey, what better person than your husband? That's right. Go ahead. First principal supervisor said, what better person than your husband? Right. So you can get a couple breast exams in a month. But that's a whole nother talk. You know, I do the talk on sex and sexuality. Okay. So now other risk factors, I want y'all to get this because we don't talk about it enough. And this is why we need to be talking to mothers and their children. Daddies need to be talking and all this. If your period started before you were 12 years old, you're at increased risk. If you have a daughter whose period has started before she was 12 years old, you need to talk to her about an increased risk of breast cancer. If you never had children, or you had a miscarriage and you only had your first live birth after the age of 30, you're at increased risk for breast cancer. Y'all hear me on that? And if you start menopause after the age of 55, right? You're at increased risk. Y'all got that? Elaine Smith says, men need to do an exam too. My ex recently passed away, metastatic breast cancer and prostate cancer. My prayers are with you, Elaine, and thank you for that point. We talked about men do get breast cancer. Again, going back to this, because we don't hear this enough. If your period starts before 12, if you never had kids or you had your first live birth after the age of 30, or you start menopause after the age of 55, you're at increased risk. Why? Greater exposure to hormones puts you at increased risk. So if your period starts before 12, your hormonal levels start to spike and go up and down. And that's a risk factor. That's why I want men to know about this as well. Don't just say, oh, breast cancer is a women's issue. No, you got women in your life that you love. Those are risk factors. Hormone therapy, if you've been taking the pill or you've been taking estrogen, progesterone, hormone replacement, you're at increased risk. That's why you should take hormone replacement if you have to. Because if the hot flash is about to kill you, you're going to have to take it for a little bit, but come off as soon as possible. And perhaps one of the greatest risks for breast cancer, which I always usually put at the top, is number one, being a woman. Number two, having breasts. But guess what? If you have had breast cancer, you are at increased risk of breast cancer. And so that is a risk factor. Okay, y'all got that? And then if you have a specific type of breast cancer called lobar carcinoma in situ, that is a risk factor. And then finally, you can't do nothing about those things. But that lets you know you need to do your self-exams, you need to get a mammogram earlier than 40, and you need to be aware and you need to talk to your family. But what I want to share is things that you can do something about. If you drink alcohol, and you drink alcohol to excess, and generally if it's more than 4 glasses of 8 ounces of wine, ain't no science to that, but you know if you drink too much. If you drink alcohol a lot, if you are obese or overweight, and if you do not exercise, inactivity, all of those are risk factors for breast cancer. Are y'all learning something? Just wave at me if you're learning something. Hit a heart or something. Do something. You're supposed to. All right? So now, I have to preface this. I did reference my work with the American Cancer Society. There are recommendations that American Cancer, Komen, and other people have on breast cancer screening. And then there are recommendations that health professionals have. There was all of this controversy years ago, and even now it's still controversial on who should get screened when. Insurance companies got involved, all this. Let me tell you what this is. I'm going to tell you, number one, what American Cancer says. Then I'm going to give you the real talk from Dr. Sharon. So, mammogram beginning at age 40 and then yearly. Clinical breast exam, 40 and older, yearly. And these were the previous guidelines. Clinical breast exams, 40 and older, and then yearly. Clinical just means a doctor or somebody examines your breast. Nurse practitioner, somebody in a doctor's office examines your breast. And then if you're 20 and 30, they say 20s and 30s every 3 years. But mammogram beginning at age 40. So now, those are not the official, those are what I'm telling you, okay? So now, let's go back over this. Those are previous recommendations. And then we kind of change the recommendations, and some women, whatever. If you have breast and are a woman, every state in the country has free breast exams. So don't tell me you don't have insurance so you can't get a mammogram, a mammogram. You can do the work. You Google everything else. You Google to find out who's got the sale this month. Google and find out where you can get a mammogram. This is real talk, where you can get a mammogram free. Okay? All right. So number 2 is this. If you have a family history or any of the risk factors I talked about, get your baseline at 35, not 40. Get your first mammogram at 35, not 40, and then do yearly. If you've had breast cancer, of course you're going to be getting a mammogram and probably more extensive testing every year. So now, the other thing is clinical breast exams. Many have come off the table and said, well, they may not work as well. What harm is it going to do if you examine your breast? I mean, I've sat on commissions and said, why are we telling people that you don't necessarily have to examine your breast every month? It's too confusing. Honey, you got breasts. Feel them once a month in a self-breast exam. Period. It ain't going to cost you nothing. And guess what? I don't care if 1,000 women do it and nothing shows up. That one person that finds breast cancer, and we know that if a person finds breast cancer herself or her mate finds breast cancer at home versus a doctor's office, we know they typically have a better outcome if they've been following the recommendations. Get a mammogram, baseline at 35 if you're at risk, at 40, and then every single year. We know now that the recommendations are that you can go to 2 years, for some people 3 years. It's too confusing. I ain't that smart. Get a clinical breast exam, all right? That means your doctor examines your breast. I tell you all the time, you need to be butt naked in the doctor's office at least once a year, because they need to see your skin. And part of the breast exam, and I talk about laying on the bed and putting the hand behind your back, but part of your breast exam is standing in front of a mirror with your hands on your hips, bending over, looking at your breast, standing up to see if they're symmetrical. Everybody's breast, one is larger than the other. We know that. One droop a little bit more, one a little bit lower. You know, they're a little different. But a drastic difference that you notice by looking at your breast is important. So if you're at high risk, you need to actually start testing at 30. And then talk about whether you need a 3D mammogram or not. I say this, just keep it simple. If your insurance will cover a 3D mammogram, get a 3D mammogram. If it's $25 more, pay the $25, right? Because it does look, it is three-dimensional mammogram or MRI or whatever, a three-dimensional mammo. And then the other part is, do not just jump to MRI. Don't just jump to I want ultrasound. The mammogram remains the gold standard. Y'all got it? And then those full body CTs that people charge you a couple $100s for, you can throw that out. I'll do another whole talk on that foolishness. All right. So now, how to lower your risk. Discuss your family history and personal history again. Y'all worried about who Shanae's real daddy is at Thanksgiving, when you need to be talking about what's going on in our family. Somebody have a stroke, somebody have a heart attack, somebody got cancer. And not to be in their business, number one, but to help the future generations. That y'all know I talk about my nieces all the time. If I get cancer, they need to know that auntie has had breast cancer, and then they need to tell their doctors, okay? Maintain a healthy weight throughout life. Don't take hormones. Breastfeed, okay? Breastfeeding lowers your risk for breast cancer. Y'all know that? Did I teach y'all something? Okay, so what do? You see a new lump or mass, immediately call your doctor and get in to see your doctor. If you see swelling in one part or all of the breast, you see swelling that's abnormal, call your doctor. You see that the skin, oops, that was my mama. The skin looks like an orange peel. Call your doctor. Not the color orange necessarily, but raised and looks dimpled in. Call your doctor and get in and be seen. And be persistent. Be persistent. I need to be seen. I don't need to be seen in 3 months. I need to be seen now. Not today. Don't be a butt. But hi Earl Hines. Hi Salika. Don't be a butt. But I need to be seen, right? If the nipple, you're having pain at the nipple or the nipple turns inward, that's important. Discharge from the breast is not milk. That may not be breast cancer, and none of these may be breast cancer. You could have a superficial infection. So don't now go talk about I got breast cancer because some stuff came out of my right nipple that's wrong. Number one, you could be pregnant. I'll talk about the menopause baby some other time. But you could be pregnant. Salika's on the OBGYN. You could be pregnant at 55-year-old, but getting pregnant. Okay. But you also could have a prolactin tumor in your head, and you're putting out prolactin, which is a substance that's white and milky that comes out of the breast. So don't now get scared and all that. Let's just go handle your business, okay? And then I'm not going into treatment and all that. Do y'all got any questions? Or any questions? It is important for me to talk about the new study that just came out in the Journal of the National Cancer Institute. And this shows that black women were more likely than white women to have difficulty affording and taking endocrine therapy, which is a type of therapy in a 10-year plan. This just came out. This is one of the things that I've shared around the country. Why? Because for breast cancer and cancer treatment, the amount, and Episcopal Supervisor Marla Michon Hall Reed was on early, and one of the things, and thank you all, we got over 30, 40, 50 responses to a question that I asked about what would you want people to know about cancer if you are a cancer survivor or have walked through cancer with somebody else. And she talked about the financial burden. Often we think about that being the burden of going to the doctor and all that. No, you got to put gas in the car to go to the doctor. You got to go pay your copay. You got to get a babysitter. You have other factors. If you've had surgery, you need to get bandages. Please contact the American Cancer Society, Komen Society, those things. There is support out there for you. But that study showed that women, particularly black women, have worse outcomes because often they are not able to be as compliant, which means follow the doctor's instructions, get your therapy on time, take your medications as well. And what happens is that leads to increased death rates, and that's a new study. So y'all got any more questions? I love the question about fibrocystic breast. Absolutely not. You're not at increased risk simply because you have fibrocystic breast. However, it is harder if you have a lump to kind of know what the lumpy breast, what's a real lump and a hard lump. Any other questions? Salika is an OBGYN. You got anything to say, sis? Earl, Dr. Hines, any of my docs that have come on. I see my longtime assistant and my boo, Sherry Warren. I ain't gonna bother you today, it's Friday, but she is on. And also, please go to the Keith Warren Foundation's website. We have talked about Trayvon Martin. We're talking about social justice, but in Montgomery County, there was a young man that was murdered, put on a tree, and we are convinced he was murdered, hung on a tree in Montgomery County, and they ruled it a suicide. How a man can hang himself on a tree himself, change his own clothes, and then they close the case. So please go to the Keith Warren Foundation's website and look at this case of a young man we believe was murdered over 20 years ago, and do help that foundation's efforts in social justice, Montgomery County. Okay, guys, I told you it would be, yep, that's right, Keith Warren. Sherry Warren is his sister and the executive director of the foundation. Young man hung. They called it a suicide, and she has been fighting for the family and herself, but more importantly for her brother and her mother, who dedicated her life to getting justice for her son. So that's Montgomery County, Maryland. My county. I live in Montgomery County. Great. Thank you. Please put up the Keith Warren Justice site. Again, this is before Trayvon Martin, and they didn't do an autopsy. They embalmed him without the family knowing. So do check that out. Thank you all for watching Facebook Live. Do me a favor. Did y'all learn something? Just let me know if you learned something. Okay? For all of you that said you learned something, I'm Dr. Sharon. I try to keep it real and to the point. So we talked about triple negative. We talked about risk factors for cancer. We talked about what cancer is. We talked about what you should really do. I don't want to hear the fluff stuff. I want to know as a woman what I need to do, as an auntie what I need to tell my nieces and nephews, and what I need to tell y'all. We talked about triple negative probably in a way that you haven't heard it. And we talked about risk factors, like did y'all know if your baby girl gets her period before 12 that she actually is at increased risk for breast cancer. Y'all know that? And did you know that at Thanksgiving, y'all need to sit down and talk? Thank you, Debbie. Thank you for my survivors that are on. Shout out to them. Let's keep them in our prayers. And you all just the best messengers of how to deal with cancer are people that have actually dealt with it. I talk to thousands and thousands every year, but I'm not the best. It's always best when somebody who has walked it and lived it. I can tell you the science, but I can't tell you what it is to wake up after surgery and have to go to chemo or radiation or whatever. But thank God that you all are still here. We're looking for you to be 10, 20, 30, 40, 50-year survivors and to be ambassadors, whatever type of cancer it is. Please tell your story. Somebody needs to hear it. Men, we need you to tell your story. Thank you so much, everybody. Y'all have a wonderful weekend. I'm going to sit on my little porch. I think I'm going to bring some coffee out here because it's a little cold. The other final shout out is please get the flu shot. All right. Have a wonderful weekend. It's been a rough week. Y'all all right? It's been a rough week, but you know what? We're still here. We're still standing. And every time you can take a deep breath, you still have hope. This is Dr. Sharon Allison Adi talking Facebook Live. Please repost it. You just don't know if one of your friends will hear something that will save his or her life. You all have a great day. Let me call my mama back because she called me in the middle of Facebook Live. Thank you all for all of the shout outs. Love you. Bye-bye. It's Friday night. Didn't get paid.